Hi, I'm Dr. Beth Liston, representing Ohio's 21st House District. Joining me today, I have Dr. Bill Cutton, a pediatrician and public health advocate from Columbus. He's here to talk to us about the unprecedented measles epidemic we've been hearing so much about. Welcome, Dr. Cutton.
Thank you, Beth.
It's great to have you here. I know you bring a ton of knowledge. Can you share a little bit about your background?
Sure, Beth. I'm a recently retired pediatrician. I have greater than 30 years experience with Nationwide Children's Hospital as medical director of their primary care network. I'm a past president of the Ohio chapter of the American Academy of Pediatrics, as well as the Columbus Medical Association, and I am co-advocacy chair for actually both of those organizations now.
So you truly are an expert. So I'm very honored for you to be here and share information to all Ohioans. We've been hearing a lot about measles. Can you tell us what's been going on with that?
Yeah, right now there's a measles outbreak in almost every state. We haven't seen anything like this for years. Measles was almost totally eliminated in the United States. Large groups of children and some adults have decided not to be immunized against measles and are susceptible. And one of the things that has happened is people have become complacent about the disease, thinking it's just a fever and a rash. But really it has some very bad outcomes, including death. And many just have forgotten how bad this can be.
Sounds important. And you alluded to this, but can you explain more about why this is happening now and what the risk is?
Like I said, measles was nearly eliminated in the United States. But about 20 years ago, an English physician and researcher, Dr. Wakefield, did some bad research and connected measles with autism. This put on such a scare that even not just in the United States, but internationally, people stopped vaccinating or decreased their vaccinations. And despite multiple studies to prove that measles does not cause autism, it's a very, very safe vaccine, the popular press, celebrities, and social media have encouraged people to not vaccinate their children and for some adults not to get vaccinated. Measles is really infective. And you have to have greater than 90% of the kids immunized to really keep the disease under control. The immunization rate has dropped below that, and that's why we are seeing these outbreaks now.
So what can we do? What can Ohio families do to keep themselves and their children safe and healthy?
First of all, kids need to be immunized at the proper age and following the proper schedule. That's the best way to get this done. If your child's behind in their immunizations, you can get them caught up, and you get them caught up quickly. People listen to their friends, and if you believe in immunizations, and most people do believe in immunizations, you should encourage your non-immunizing friends to change their ways. And then adults need to check and make sure if they're in their 50s or 60s, their immunizations may not be totally protective. And make sure if you have children in daycare, that their daycare follows the rules and that everyone in the daycare is immunized also.
Well, thank you. I think that's really important information. So spread the word, share the information with your friends, make sure that you and your families are protected. I'm Dr. Beth Liston, and I work for you.